Hello friends, welcome to EduSkills OET Made Easy. I'm here to make you fall in love with OET, Occupational English Test. Are you ready to travel with me? Come along. Let's jump into the session, enjoying the experiential learning.
So good evening, everyone. Once again, welcome to the session. Today we'll be looking into listening part C, text 2, which is a monologue, and many of your concerns, many have texted me earlier as well. These days also I got concerns regarding the monologue being very challenging to understand. So we'll be looking into not the whole text, but then I'll introduce you into the strategies. Then you have to work out yourself, and hope you have done this task by yourself and you have a text with you. Yes. And if you are watching on YouTube, kindly consider subscribing, give us a thumbs up if you like the work, and share the video so that we empower each other and grow together, so that we reach out to many who are struggling to crack OET. And listening part C, let me share my screen. Okay, Occupational English Test, listening part C, text 2. We'll go fast, listening key skills. This is just to bring your attention to something what we have been looking into. Okay. Synonyms, synonymous language, paraphrasing, scale, modal verbs, which speaks about opinion or fact, chronology or time expressions, name of a device, disease, person, organ, comparison and contrast, number, which could be age, year, something of that sort, and stem words, which may be reason, why the question speaks. Why means reason, because means a cause, and effect language will be used. Then you have the topic sentence or the key word or phrase. Then you have reference, negative meaning, and the last is conclusion. Okay, these are the few things we have dealt with in many sessions. And if there are some beginners, please don't mind. We will have a session for the beginners immediately within a couple of days. We'll be explaining to you the details. Okay. No, when you listen to the audio, it's ultimately, I told you, reading and listening is almost same. There is no difference. In reading, you read and understand, identify the answers, whereas in listening, you listen the audio and identify the answers. Strategies are almost everything same. So you should know how to skim the audio. As you skim the text, you should be able to skim the audio. So when you skim the audio, synonyms, synonymous language, all these things, as I told you, these 14 things I don't want to repeat again. You can see on the screen. Synonyms, synonymous language, paraphrasing, scale, modal verbs, time expressions, name, comparison and contrast, number, stem words, keyword or phrase, reference, negative meaning, and conclusion. These things should be identified in your audio. Okay, and the text will have its sequence. Before we go into that, let's just go into the audio.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a presentation by a consultant cardiologist called Dr. Pamela Skelton, who's talking about a research trial called SPRINT, which investigated the effects of setting lower blood pressure targets. You now have 90 seconds to read questions 37 to 42.
Hello, I'm Dr. Pamela Skelton, consultant cardiologist at this hospital, and I'm talking about the recent SPRINT study into the effects of setting lower blood pressure targets, which in turn affects the advice and medication which patients are given. I'm going to describe the patients who were selected, how the trial was conducted, and the implications of its results for us all as health professionals.
Do you have a paper and pen with you?
Yes,
Yes,
Father.
yes,
Yeah.
Father.
Yes, Father.
Yeah. This is the introduction part. You have to write down what is the topic and what are the three things the speaker describes. There are three things being described in this audio. Introduction speaks exactly what is the main topic and what are the three aspects the person is going to describe in this audio.
Hello, I'm Dr. Pamela Skelton, consultant cardiologist at this hospital, and I'm talking about the recent SPRINT study into the effects of setting lower blood pressure targets, which in turn affects the advice and medication which patients are given. I'm going to describe the patients who were selected, how the trial was conducted, and the implications of its results for us all as health professionals.
Did you get?
Yes, Father.
Who got it? Could you read it? What is the topic and what are the three aspects being described in the audio?
Talking about print study.
Print study
Okay.
and the aspects.
Medications,
Lower
implications of its results.
trials and implications.
Advices who all are the patients who participated, how the trial was, implication of this effect.
Okay. Listen once again. The introduction part is the most important thing. Unless you understand what is the topic and what are the aspects being dealt in this audio, you will not be able to follow the audio. So listen carefully.
Hello, I'm Dr. Pamela Skelton, consultant cardiologist at this hospital, and I'm talking about the recent SPRINT study into the effects of setting lower blood pressure targets, which in turn affects the advice and medication which patients are given. I'm going to describe the patients who were selected, how the trial was conducted, and the implications of its results for us all as health professionals.
Let me share my screen once again. Now, for your information, I told you as you do the listening, what you have to do. First step, you can write down if you don't know, if you are new. First step is to do the task in examination conditions. Whatever the time is prescribed, do it in the examination condition. Second, refer the key and find out your score. Third step, mark your score or record your score in the self-assessment form. Fourth step, listen again to the audio. Listen again to the audio and try to understand the answer. Whether you understand now as you have referred into the key, do you understand the answers which you made a mistake earlier? Then step 5, take the script, listen to the audio and highlight the strategies and the answers. Okay, listen, read and write. So all these visual, audio and kinesthetic three skills are working together in your listening test. You need to do this with patience, otherwise whatever the practices you do, you will not be, that may not help you much. So what are the 5 steps? First step, do in the examination condition, do the task in examination conditions. Second, refer the key and identify the mistakes and calculate your score. Third step, enter or record your score in the self-assessment form. Fourth step, listen again to the audio and try to understand the mistakes that you made and try to understand where's the answer. Number 5, step 5. Fifth step, listen to the audio, read the script simultaneously and mark the strategies and the answer. These 5 steps has to be carried out in the beginning stage definitely until you become competent. Okay. Now, as you have your text in your hand, can you just tell me the introduction we have seen? First paragraph, what does it speak about? First paragraph in the sense, first audio part. We can take it as paragraph now for the understanding sake in the script. Yes.
Print study.
Yeah, sprint study. Yeah. So the introduction, para 1 is introduction. The second one is the trial itself or the trial. What is the sprint study is the trial. Okay. You said the title. So what is next? Yeah, para 3, before the trial. It speaks about before the trial. At the very beginning in the script you have, even in the audio you have. We will be listening to that audio again. Write down these steps. Okay, introduction, the trial itself or the sprint study. Okay, the trial itself or the sprint study. Para 3, before the trial or the pre-existing conditions. Just mark, underline before the trial in your script if you have the script in your hand. Hope you are instructed. Without script, you will not be able to understand today's session.
Yes, Father.
Fourth paragraph. See, very beginning, the audio speaks about to manage their blood pressure. So, managing BP. Okay, the concept in the 4th paragraph or the 4th section of the audio is managing blood pressure. 5th paragraph is comparison and contrast. That is accord, another study exactly like sprint. So 2 studies are being compared. 6th one, author's recommendation or view. Author's recommendation or view. 7th one, the implications of its results for health professionals. Can you see the script here?
Yes, Father.
Yes, Father.
Okay. Just check out here the highlighted things. See the first paragraph, introduction. Second paragraph, first the trial itself. Third paragraph, before the trial, means what was the precondition of the patients. 4th one, to manage their blood pressure. 5th one, comparison and contrast between accord and sprint, 2 studies. 6th one, summary, the recommendation. 7th one, the implications to the health professionals. The results of this study, how does it influence the health professionals? Now just read the questions. Anyone, please.
Why was the sprint trial stopped before it was due to end?
Okay, why? So what should be the answer? Reason. Okay.
Yes.
Before, I'm just trying to tell you the strategies. Okay, how you have to analyze the strategies. This you can listen as well, but as of now, we'll take a lot of time to go back to the audio every time. So what is this? Before. Okay. Do you have a synonym of before in these sentences? Options. Just read the options.
Options.
Earlier.
Earlier
than
expected.
Read the options, all the 3 options, please.
There were conclusive results earlier than expected. Option B, the high dropout rate was likely to invalidate the data.
Yeah.
Option C, concerns were raised about possible effect on all the participants.
So you said there is a synonym here, right?
Yes, earlier and before.
Earlier and
Before.
yes, earlier. Yes, earlier, here, before. So what is the answer?
Yeah.
Conclusive result earlier than expected. That is the answer.
So does the synonym work?
Yes, Father.
Yes,
It was due to end. Okay, and than expected are the synonymous language. Okay, conclusive than expected. So this is the paraphrasing of this sentence. So you, in this context, even without going to the audio, can you understand the answer?
Yes, Father.
Yes,
Yeah.
Father.
Because I'll be showing you just 2 paragraphs or 2 answers, 2 portion of the audio. and I tell you, it is conclusively damn sure what is the answer. So as you read the question and answer, the method is here, QAT, right? Q question, answer options, then audio, call method
Yes.
we call it. Listen to the
Yes,
audio,
Father.
okay? Because the simple trick is this, whenever there are 3 options, questions and answer options, then text or audio, okay? Whenever there are 4 options, questions, text, answer options. There's a difference, okay? So we will check out the details in the text later. So just telling you. Yeah.
Sorry, so come again, Father. I didn't get you.
Whenever there are 3 options, multiple choice 3 options, whether in reading or listening, question first, answer options next, then the audio or the text.
Okay, Father.
QAT method. Whenever there are 4 options, questions, text, answer options. QTA method, whether it is in reading or listening. Got it?
Okay, Father.
And conclusive. Here you see conclusive. Conclude means stop, right?
Yes, Father.
Yeah. Conclude means stop. Stop your work, or conclude your work means stop your work. So 1, 2, 3 synonym and synonymous language in the answer option as well as the question. So you need not go anywhere. Only you need to listen to the audio just to confirm the answer. Okay. There is a question issue. Okay. This is 37. This is 38. Okay. Or 31 and 32. Okay. Now you see, read this one, second one. Yes, please.
A few participants aged over 75 left the trial because
Yeah. Options.
option A, there was a negative impact on their daily life. Option B, they failed to take the required doses of medication. Option C, their health deteriorated due to pre-existing conditions.
Okay. A few participants aged over 75 left the trial. So what is a few?
Some.
Some means that, what is it called? The strategy?
Scaled.
Okay. Okay. And here 75 number. Yes. And because there is a word because, so it says there should be a cause given, cause and effect, not reason, cause and effect, right? Because of this, check. Okay, third one.
A significant features of measuring blood pressure in the trial was that option A, the highest of 3 readings was recorded. Option B, the patient was alone when it was cried out. Option C, it was done manually by the participant at home.
Okay. Are you able to see this one? PPT?
Yes, Father.
Yes, Father.
Okay. So we were here. Right?
Yes, Father.
So the questions you see, the questions sequence I am giving you. Since you have done, I don't want to read the whole thing. Just the questions. The 37 reason to stop the trial before due time. Okay, there was a trial, but then it stopped before time, right? So what is the reason? First question is that. Second question speaks about reason for over 75 years left the trial. Okay, those who are above 75 years left the trial or the study. They stopped attending the trial. Why? The reason should be given. 39, significant feature of measuring BP. What is significant in measuring the BP? Every day for years together, the BP should be measured of each participant. So was there something significant in measuring the BP? And sprint and accord difference. There is a comparison and contrast between sprint and accord study, 2 studies, and the difference is being asked in 40th question. And 41, Dr. Skelton's recommendation about sprint. 42, author's opinion or view about the implications. Is that clear?
Yes, Father.
This is the gist of the question or question stems. Okay.
Yes, Father.
Now we will compare the question as well as the paragraph. Para 1, introduction. There is no question from introduction. That's the summary I told you. But that is the most important thing for you to understand the following audio or text, whatever, in reading text. Paragraph 2, the trial, reason to stop the trial before due time. So there was a trial or a study, how long it was supposed to be, but it stopped beforehand, before the completion of the time. So what is the reason? So para 3, pre-existing conditions before the trial. The audio begins saying before the trial. Now it is pre-existing conditions of the patients who were participating. The question asks about reason for over 75 years left the trial. There was some reason, and we'll understand that is precondition. And managing the BP. Paragraph 4 speaks about managing BP, and the question 39 concerning this paragraph speaks about significant feature of measuring BP. Managing BP, what was significant than the normal thing? Para 5, accord versus sprint, a comparison between two studies. And the question 40 asks sprint accord difference. What is the difference between accord and sprint? And paragraph 6 speaks about author's recommendation, and the question 41 speaks Dr. Skeleton's recommendation about sprint study. Okay, and para 7, the implications of its results for health professionals, and for question 42 speaks about author's opinion or view about the implications. Do you see the connections?
Father,
Father.
screen.
Was the PPT visible to you, or you are looking at the text?
No, only the 32 question. The question.
Yes, yes.
Now this is audible, visible. Hello, I am Dr. Yeah.
Script is there. Yes, yes, Father.
What I told you is the sequence in the questions. Question 37 speaks about asks about reason to stop the trial before due time. The trial or the study was stopped before time. What was the time prescribed was for 5 years, but then they stopped it before. That's why we saw the synonym before and earlier. Okay. 38 speaks about reason for over 75 years left the trial. Why did above the age of 75 participants left the trial? There was some reason. 39, question 39 speaks about significant feature of measuring BP. Normally, you know how the BP is measured, but there was something very special, significant about this particular study regarding the measuring BP. And question 40 speaks about sprint accord difference. I said there is a comparison and contrast between two studies. One study is accord, one study is sprint. So what is the main difference? Question 40 wants it. And 41 asks about Dr. Skeleton's recommendation about sprint, this particular study. And 42 speaks about author's opinion view about the implications of this study, or the implications of this results of this study on the health professionals. How does it influence? Next step is text sequence and question sequence. As we have seen, text sequence introduction, there is no question from introduction, but I told you it's very important from the understanding part of the audio. Following part, if you have to understand, you have to understand the introduction well. Para 2, the trial. Okay. And the question 37 speaks about reason to stop the trial before time. Okay. Why the study was stopped before time? Pre-existing conditions. Para 3 speaks about before the trial. It starts, the audio starts saying before the trial, means pre-existing conditions of the participants or patients. So 38 speaks about reason for over 75 years left the trial, means those who are above 75 years old left the trial. What was the reason? And para 4 speaks, or the fourth part speaks about managing BP. And question 39 speaks about significant feature of measuring BP, managing BP. What was significant? There was something very specific or special or significant about this particular study regarding measuring the BP of the participants. Para 5 speaks about comparison and contrast between accord and sprint, the two studies. And the concerned question 40 speaks about sprint accord difference. There was a main difference, major difference, or a significant difference between these two studies. What is the difference? And para 6 speaks about author's recommendation. And the question concern is 41, Dr. Skeleton's or author's recommendation about sprint. And para 7 speaks about the implications of its results for health professionals. And the script or the audio in the question, it speaks about author's opinion view about the implications of this study on health professionals. Is that clear?
Yes,
Yes,
Father.
Father. Yes, Father.
Yes, if you are practicing as per EduSkills strategy, this is what you are doing. I told you even in all my previous sessions, I have showed you this way. And for you to practice one reading will definitely take one reading material or listening material. It will definitely take 1 week, not less than that. Properly, if you understand it. Could you read this? We'll understand how to get the, then we'll again listen to the audio so that we get a clear picture. Yes. This is the introduction.
Hello, I am Dr. Pamela Skelton, consultant cardiologist at this hospital, and I am taking about the recent SPRINT study into the effects of setting lower blood pressure targets, which in turn affects the advice and medication which patients are given. I'm going to describe the patients who were selected, how the trial was conducted, and the implications of its results for us all as health professionals.
Okay. Now I don't know whether I can highlight. Let me check. Can you see the screen?
Yes, Father.
Is
Yes, Father.
that is readable, right?
Yes.
Yes, Father.
Yeah, I am also connecting this to the reading passage, reading article or reading text. See here, I am talking about means what is the topic, right? I am talking about. So it speaks about the topic. Yes. What is the topic? SPRINT study into the effects of setting low blood pressure targets. That is the topic, main topic. SPRINT is the study, is the name of the study. SPRINT. Then what does it study? Effects of setting lower blood pressure targets. Okay. Then I am going to describe. This is the content of the whole audio or your reading text. Describe one selection of patients. Then how the trial was conducted. That is the procedure of trial. Then the implications.
Not visible, Father.
Not visible?
Not visible. No.
Then how come you told me it is visible?
Visible, Father.
It's visible. It's visible to us, Father. It's visible to me.
Okay, fine,
Yes,
fine. Then there is some issue at your end. You have to keep, if you are attending from the phone, always see that you keep the phone in landscape mode. And if you know how to set the pixels or the resolution, set it to 720 resolution. So it will be very clear. Okay, and you can also zoom in or zoom out. Okay, there is nothing special which I showed you. I made it once again, highlighted it. That's all. Is that fine?
Yes, Father.
Yes, Father.
Yes. Yes, I'll show you in a bigger screen now, those who could not see. Is it visible now? The topic
Yes,
is
Father.
about the recent SPRINT study, the topic. And the contents of this audio is mainly patients who were selected, how they were selected, and how trial was conducted, and the implications of its results on the health professionals. Okay, this is the introduction. In your reading article or reading text, this introduction will give you a general idea about the whole text. So you have to read it very clearly and understand the concept. In listening as well, you have to focus very much on this particular introduction in the beginning. That speaks you about the contents of the paragraph. And you see, this is the content. Topic, SPRINT, study into the effects of advice and medication, description, patient selection, 2, how the trial was conducted, the procedure, 3, the implications of its results for health professionals.
Why was the SPRINT trial stopped before it was due to end? Option A, there were conclusive results earlier than expected. Option B, the high dropout rate was likely to invalidate the data. Option C, concerns were raised about possible effects on all participants.
Okay.
First, the trial itself.
Yeah, you have to listen to this, okay, very clearly. Every time there is a transition, when you change from one portion of the audio to the next portion, there is something like this. First, the trial itself means the trial. The first paragraph speaks about the trial, and the introduction you saw the trial itself or the trial. I am going to speak about SPRINT study. So trial is named as sprint study. Yes. Next.
It
What is,
involved
yes, what is it?
Trial.
What is trial or the study? Study. This is known as reference, okay? When in the reading you have seen lexical questions and reference questions. This is known as, unless you understand this reference, you will not get connected later.
It involved over 9,000 hypertensive participants aged 50 plus, most of whom were on blood pressure medication. They were randomly assigned to one of two groups, one with a goal of less than 120 millimeters systolic BP, the other with a goal of less than 140 millimeters, the traditional standard. The intention was to follow these patients for 5 years. Factoring in.
So, you know, there is something called, Eric, you have to note. Okay,
Yes.
the time expression.
Yes.
Okay, yeah.
Factoring in the usual dropout rate. As it turned out, however, the trial
What is this?
contrast.
What is this? Yeah.
Contrast.
So it shows these two things will show you answer is somewhere here. Yes.
The trial was stopped after just 3 years.
Yeah. Again. What is it?
Stop. 3
Yeah.
number.
Time expression.
Thanks to an all-cause mortality reduction of nearly 30% for the 120 group, which was definitely one shocking, but wonderful.
Yeah, what is this? But?
Contrast.
Yeah. Wonderful.
Adjective.
Adjective, but what is it used for here? When you say someone is beautiful, does it mean he or she is beautiful for everyone? Or if you say someone is handsome, what is that?
Paraphrasing.
Opinion of the author.
Opinion of the author. Opinion of the author. So the result is wonderful within 3 years. So you see, until whatever is given here, you can just skim until you reach some of the what you call tips or the strategies I told you. So what happens? 5 years time is there, 3 years time is there. Then the two contrasts are mentioned here. Soon after that, it says wonderful means within 3 years, there was a wonderful result, significant result. That's why the trial was stopped by 3 years. So there were conclusive results earlier than expected time. Expected time was 5 years. But then in 3 years, yeah, it was stopped. But then you don't require it. 4 is here. No, earlier is here. All these things I told you. So there itself you have conclusive results. Okay. It was due to end. Before it was due to end, than expected. All these things clearly tells you this is the answer. If you want to confirm from the audio, you can confirm whereby they speak about what happened at 3 years. The intention was 5 years, but then 3 years, thanks to all. Thanks to an all-cause mortality reduction of nearly 30% mortality reducted was a great success for the 120 group, which was definitive and shocking, but wonderful. Definitive and shocking, but wonderful. After but comes the important thing, the contrast. Did you get some idea? We'll listen again to the audio, then you will understand. See the key phrase I told you, the trial itself. The audio begins with it first, second, third. So the indication is there. Listen to what is first.
First, the trial itself. It involved over 9,000 hypertensive participants, aged 50 plus, most of whom were on blood pressure medication. They were randomly assigned to one of two groups, one with a goal of less than 120 millimeters systolic BP, the other with a goal of less than 140 millimeters, the traditional standard. The intention was to follow these patients for 5 years, factoring in the usual dropout rate. As it turned out, however, the trial was stopped after just 3 years, thanks to an all-cause mortality reduction of nearly 30% for the 120 group, which was definitive and shocking, but wonderful. As I mentioned, the participants were over 50s, and it goes without saying that as people age, they develop more diseases and health problems as a matter of course. But there was a specific group of over 75s who did just as well as younger patients. Before the trial, some medics referred to the natural stiffening of the arteries with aging, suggesting that 120 was too low a target for the over 75s, risking an increase of dizzy spells, which would affect general well-being. But this concern turned out to be unfounded. Others thought there would be a failure to take the number of tablets needed to reach a BP of 120, especially among older participants. Again, this wasn't an issue. The average needed was just 3 per day. The over 75s, already on various drugs, didn't object to extra medication. Participants from this age group who didn't finish the trial were taken out because some conditions, which were already present, worsened. For example, in some cases, obesity levels rose too high.
Now?
Yes,
Yes,
Father.
Father. Yes.
Okay. Yes. Now I am going one step further. Just have a look at it. The indications I told you why, when there is a stem word why in the question, it speaks about a reason. So time expression and chronology before, earlier, in the text it is 5 years, 3 years, after. After 3 years means before 5 years, right? You have to write down these expressions and practice. Don't go just skip from practice to practice, but write down these expressions and practice. And see paraphrasing before it was due to end. Okay, can be paraphrased. This is synonymous language. These two sentences are paraphrased. This is synonymous language used before it was due to end, earlier than expected. Okay, and key phrase, the trial itself, beginning, the audio begins with the key phrase, and you have contrast, however, but. Then you have listening for emotions, we call it. When she says wonderful, yes, listening for emotions. That's another thing I told you once. When she says wonderful, there is a tone change, surprise, okay, and interest. So sometimes whenever they show surprise, interest, or sorrow, or excitement, normally that is the place where you have the answer. So this one was introduction, I told you, don't require again. Okay, here you see synonyms before, earlier, 3 years, 5 years. Synonymous language before it was due to end, earlier than expected. Modal verbs, opinion, wonderful. Chronological or time expression, first, before, after, earlier, 3 years, 5 years. Contrast, however, and but. Stem words, reason, why. Keyword or phrase, the trial itself. Reference, it means the trial or the study.
A few participants aged over 75 left the trial because option A, there was a negative impact on their daily life. Option B, they failed to take the required doses of medication. Option C, their health deteriorated due to pre-existing conditions.
Okay, because you know there is a cause. Okay, the cause has to be identified. Yes. Now start. Before it starts saying before the trial, right?
Yes,
Previous paragraph was about trial itself. Now before the trial, which means condition of the patients before the trial started, study started. Yes.
Before the trial, some medics refer to the natural stiffening of the arteries with aging, suggesting that a 120 was too low a target for the over 75s, risking an increase of disease spells which would affect general well-being. But this concern turned out to be unfounded. Others thought there would be a failure to take the number of tablets needed to reach a BP of 120, especially among older participants. Again, this wasn't an issue. The average needed was just 3 days.
3 days. Sorry, there is a spelling mistake.
Just
This
3
is
days.
3 days. 3 days. 3 days.
3 days.
Yes. And this was somewhere here, reach, R-E-A-C-H.
Reach.
Yes.
Okay.
Yes. Okay. Again.
The over 75s already on various drugs didn't object to extra medication. Participants from this age group who didn't finish the trial taken out because some conditions which were already present worsened. For example, in some cases, obesity levels rose too high.
What are these?
Negative sentence.
Okay. What are these?
Negative
see-
impression.
Left the trial.
Because
Left the trial. Didn't finish the trial. Left the trial and didn't finish the trial. Okay. Left the trial. Didn't finish the trial. Is it same? Synonymous language, right?
Yes, Father.
Which were already present. Do you see a similarity here?
yeah,
Pre-existing conditions.
Yeah. And deteriorated. Can you see a synonym there? Worsened. Worsened. See? So do you see there is similar things, the synonym and the pre-existing condition. I told you in the sequence, text sequence, this particular paragraph speaks about pre-existing conditions or before the trial, what was the situation of the patients. That's why I said if you understand the sequence, if you get the key structure or the key phrase, easily you understand what is the answer. So the sequence says pre-existing conditions. Before the trial means pre-existing, right? Before the trial. So in the very first, in the beginning you said, in the previous portion of the audio, it said the trial itself, the study. So during the study, what happened? This is before the trial, pre-existing conditions of the participants. So you see, clearly it is given and you need not go anywhere if you know pre-existing conditions before the trial. If you can understand as pre-existing condition, immediately you know what is the answer. And now I am not going to do it, but then understand these things also. There was a negative impact on their daily life. What does the paragraph speak? Risking an increase of disease spells which would affect general. When you work out, you have to work out these options also. Do they say something here or is it not given in the text? Now we see it is given here. There was a negative impact on their daily life. See, some medics refer to the natural stiffening of the arteries with aging, suggesting that 100, suggesting. Does it mean anything? Suggesting that 125 was too low a target for over 20 over 75s. Opinion, yeah.
Opinion.
Spells, yeah. Would does it speak anything?
Opinion.
Would affect. Okay. And others thought there would be. This also short form of would. Okay. There would be, which means all these are opinions, not the facts. But here they are asking for a reason, a fact. A few participants aged over 75 left the trial because no, opinion cannot be the reason. Okay. Opinion is not the fact. Opinion may be true or may not be true. Jalajan says Rajini is beautiful, but Lilimol may say Rajini is not that beautiful. So it all depends. Opinion depends on each individual. So opinion cannot be the answer when they are asking for a fact. Now fact is the answer. A few participants aged over 75 left the trial. That's a fact. Why? The reason should be a fact, right? It cannot be an opinion. So when the opinion and fact is given, if you remember in one of my sessions, I told you clearly, I explained the difference between fact and opinion language. Hope you remember. So I am telling you, you should be able to identify even these non-relevant answers. So this is not the answer because that's the opinion of some medics who nobody knows. Because of that, nobody will leave the trial. Second, they failed to take the required doses of medication. Is something given? they were already on various drugs, did not object to extra medication. They were happy, they got some more tablets. When they were, they did not have any objection, will they review the trial for that, because for that reason? No. Did you understand?
Yes, Father.
Yeah,
Yes.
the elders did not object, so that is not the reason. They failed to take the required doses of medication. They were happy to take. They were already taking a couple of medicines. Now they were happy, they have got some more. Okay, so those two are not the answers. So when you scrutinize, you have to scrutinize all the three options and find out why this one and the other one is not the answer, and why the third one is the answer. And you having a right answer is not a practice at all, I tell you. Your score is not a score unless you have answered it with conviction. This is the answer for these reasons.
Yes,
So
Father.
you have the highlights here. See, suggesting would, but there is a contrast. There the turn takes. Here you see, but his concern turned out to be unfounded, which means some medics, their concern was turned out to be unfounded, means meaningless. So that can never be the reason. Others thought there would be a failure again. So at the end, you know, didn't object to extra medication. Participants from this age group who didn't finish the trial taken out because some conditions which were already present, pre-existing condition worsened. Their pre-existing conditions worsened, so they could not continue the trial. That's why some people, a few participants aged over 75 left the trial or dropped. Now you see the strategies, how beautifully you can see. What are the strategies? See, a few participants aged over 75, participants from this age group. This age group means there is a reference. This means previously they have mentioned this age group. A few is a scale, right? And left the trial. Synonymous were taken out because is a cause, okay, not reason. Okay, and synonym due to, because is due to. See, there is a synonym because due to. And their health deteriorated. There is the reference again, due to pre-existing conditions. I told you in the sequence itself, I told you the very fact before the trial says pre-existing condition. Before the trial, what was the situation of the patients? So at the end, you have conclusion. The whole answer is in the conclusion of the paragraph. So one of the criteria, as I told you, is opinion. Along with that opinion, a suggestion, you have gist as well as conclusion of a paragraph. So at the end, they say, this is it. So you can see the synonyms here, worsened, which are already present, pre-existing conditions, deteriorated, all those things, due to, these are connected. All these are connected to each other. Opinion, you see, thought, there would be thought, suggesting. So thought and suggesting is opinion. Key phrase before the trial. Modal verb would again. Contrast but. Yes. Is that clear?
Yes, Father.
Yes, Father.
Now, yeah. Now we will also again listen to the audio once. Just try whether you can understand these things. Go through the script and underline. If you have not underlined, circle it. Okay, listen from the beginning, okay? And try to understand. Just go through, don't be distracted. Go through the script. You have this, if you have the script, okay? Or if you don't have, listen carefully. Yes.
Hello, I'm Dr. Pamela Skelton, consultant cardiologist at this hospital, and I'm talking about the recent SPRINT study into the effects of setting lower blood pressure targets, which in turn affects the advice and medication which patients are given. I'm going to describe the patients who were selected, how the trial was conducted, and the implications of its results for us all as health professionals. First, the trial itself. It involved over 9,000 hypertensive participants, aged 50 plus, most of whom were on blood pressure medication. They were randomly assigned to one of two groups, one with a goal of less than 120 millimeters systolic BP, the other with a goal of less than 140 millimetres, the traditional standard. The intention was to follow these patients for 5 years, factoring in the usual dropout rate. As it turned out, however, the trial was stopped after just 3 years, thanks to an all-cause mortality reduction of nearly 30% for the 120 group, which was definitive and shocking, but wonderful. As I mentioned, the participants were over 50s, and it goes without saying that as people age, they develop more diseases and health problems as a matter of course. But there was a specific group of over 75s who did just as well as younger patients. Before the trial, some medics referred to the natural stiffening of the arteries with ageing, suggesting that 120 was too low a target for the over 75s, risking an increase of dizzy spells, which would affect general well-being. But this concern turned out to be unfounded. Others thought there would be a failure to take the number of tablets needed to reach a BP of 120, especially among older participants. Again, this wasn't an issue. The average needed was just 3 per day. The over 75s, already on various drugs, didn't object to extra medication. Participants from this age group who didn't finish the trial were taken out because some conditions, which were already present, worsened. For example, in some cases, obesity levels rose too high.
You can unmute and distract me and others, no issues. If you have some concerns, I have taken only 2 just to make you realize what it is. And just imagine how much time it will take to scrutinize 7 of them.
Father,
Yeah.
could you please explain 40 number 1 question of this listening part, the listening star?
41.
Yes, Father.
1 second.
Everyone has the concerns related to that question.
This one, no? Dr. Skelton's main reservation about the sprint trial is that it ignores. Is
Yes,
that the one?
Father, yes, that one, yes.
Okay. Main reservation about the sprint trial is that it ignores wider implications of lower blood pressure. Its results go against the existing body of evidence. It was unduly influenced pharmaceutical companies. Skelton's main reservation. Main reservation means some objection. Okay. So it's an opinion, Skelton's opinion.
Okay.
Somebody read, yeah. So could you read a little more this?
So, to summarize, the sprint trial seems to support 120 as a recommended blood pressure target. This is doubles a landmark study and importantly, one which was sponsored by government rather than by the interest of the pharmaceutical corporations.
Yeah, what does it mean? It was unduly influenced. Now, third option is it was unduly influenced by pharmaceutical companies. What does it speak here? It was sponsored by government, not by
sponsored by government,
not by influenced by
rather
the
pharmaceutical corporations.
So that can be striked out, right?
Yes, Father.
Yeah. Yes, gone. Yes.
I recommend a note of caution though, as sprint does contradict previous findings.
What is this? Previous findings? Do you have previous finding? Existing body of evidence.
Existing body of evidence.
What is that? Previous findings, right?
Yes, Father.
Yeah. So the caution, recommend a note of caution means my main reservation. A note of caution means my main reservation. Reservation means I don't agree.
Okay.
It goes against the previous conditions and wider implications of lowered BP. Does it give anything about it? Let's bear in mind. Yeah. Is that clear now? Answer?
Yes, Father.
See, I recommend a note of caution. I means Dr. Skeletons.
Skeleton.
Yeah, he's the speaker, right? So he recommends a note of caution means reservation. A note of caution means Sukshikanam.
Okay. In Malayalam, you say no. ഇതെല്ലാം ആണെങ്കിലും ആളെ ഒന്ന് സൂക്ഷിച്ചോണം. ഇടയ്ക്ക് വെള്ളം അടിക്കാൻ സാധ്യതയുണ്ട്. Right? Something of that sort. That is a reservation, no? ഞാൻ ഒരാളെ പറഞ്ഞു വിട്ടു, ലിലിമോളുടെ വീട്ടിലേക്ക് ജോലിക്ക് ഒരാളെ പറഞ്ഞു വിട്ടു. ഞാൻ പറഞ്ഞു നല്ല മനുഷ്യനാണ്, ഭയങ്കര ആത്മാർത്ഥതയാണ്, പിന്നെ എന്നാ മരിച്ചു കിടന്ന് പണിതോളൂ, എല്ലാം ചെയ്യും. എന്നിട്ട് ഞാൻ പറഞ്ഞു, പക്ഷെ സൂക്ഷിച്ചോണം, വെള്ളം അടിച്ച ആള് പ്രശ്നമാണ്. അപ്പൊ എന്റെ റിസർവേഷൻ അല്ലത്. ഞാൻ പറഞ്ഞൊരു റിസർവേഷൻ അല്ല, ബാക്കി പറഞ്ഞ എല്ലാത്തിനും എതിരായിട്ട് പറഞ്ഞിരിക്കുന്ന ഒരു റിസർവേഷൻ അബൌട്ട് ദ സ്പ്രിന്റ് ട്രയൽ. അപ്പൊ ആദ്യം പുള്ളി പറഞ്ഞു, to summarize, the sprint trial seems to support a 120 as a recommended blood pressure target. This is doubtless a landmark study and importantly one which was sponsored by government. എല്ലാം നല്ല നല്ല കാര്യങ്ങൾ പറഞ്ഞു. അത് ഇത് 1 2 3 4 പക്ഷേ സൂക്ഷിക്കണം. Got it?
Okay.
So what I am telling,
and
these are the language tricks and language functions used in all the questions, all the texts, not only this one. And almost every strategy or these tricks are repeated. So that's why I said, if you understand properly, take 1 week for one material, one listening, A, B, and C, scrutinize it and understand the language. And when it comes to comparison and contrast in this paragraph, here you have beautiful tricks. To understand this one paragraph, it will take you at least a day. You have to write it down, translate into Malayalam if need be. Okay? Same comparison and contrast trick will be same. Everywhere it will be, see, unlike sprint, the accord study allowed diabetic patients to take part. Unlike sprint, the accord study allowed diabetic patients to take part. It's what is the question? Question is not here. One sec, I'll bring the question. See, unlike sprint, the accord study allowed diabetic patients to take part. Sprint involved higher risk. No, sprint included patients with diabetes. Read those things, 2 things. Try to write down that. Unlike sprint, the accord study allowed diabetic patients to take part. And write down another one. Sprint included patients with diabetes. What does it mean?
It's opposite of statement.
Yeah, opposite. And here you see, sprint had fewer participants. See here, blood pressure levels. Sprint, there are some differences though. For example, accord was about half the size of sprint. Accord was about half the size of sprint. Write down that. And sprint had fewer participants. What is the connection?
It's also opposite.
Opposite.
Yeah,
Opposite of
means,
the statement.
Yeah, actually,
Contract.
yeah, what you have to do, sprint, you have to say, maybe you can write Lillimore had 50 friends. Then here you can write accord Jalajam had half the number of friends, which means 25 friends, right?
Yes.
25 friends. So this says
Yes.
sprint had, this says Lillimore had fewer friends or less number of friends. Is it correct?
No.
No. So what I'm telling you, you have to write down this portion of the text and this option and understand and study. And this is being repeated in all the questions. I tell you, this is not selected by me. This is a audio and text sent to me by Soumya when I asked her for a session. I did not select the text. I don't do. So there is no meaning. It doesn't, I don't count it as a practice. If you understand this is the correct answer and you get the score, that is not a practice. You have to understand why that is the correct answer. Being right is not the thing that you need. You should understand why that is the answer, why the other things are not the answers. Why I'm telling you, whenever there is a comparison and contrast question, the same strategies will be followed. You write down and see from the various materials, listening material audios that you listen to. Same language option will be repeated to confuse you, using words like unlike, half of it, all those things. Did you get my idea?
Yes, Father.
Yes. Yeah.
Yes, Father.
So fine. It's a bit advanced. If there are beginners, they may find it a bit challenging. But what I want to draw your attention to is this. You have to develop the competency by scrutinizing and understanding the language. Doing practice will not help. Don't do practice after practice. Understand every option and the language tricks being used there. The problem is no patience. No, rush. Everybody has that issue. And people, I am frightened when the people say they have written 8 times, 10 times. There are so many in our platform who have written 8 times, 10 times, 12 times, 40 times. I don't count it as a qualification. It's all a disqualification. The more you have written, it's a disqualification because you are tend to do what is wrong. If you can practice accordingly with these 5 steps, listening. And now I suggest you take up this listening and listen it for a week. Just listen, keep the audio some or other in your ear, maybe while you are working, and try to associate with the PPT or with the points I explained or the answers. Okay, so you really understand the accent and you really understand what are the tricks they are playing. If you noticed when they said wonderful, there was some tone change, right? There is a surprise and interest in that word. And they stop it there. And when there is an answer, they stop. Normally they stop. There is a gap asking you to write. Okay.
Then it wasn't an issue. There are also some tone changes there.
Yeah. It wasn't an issue. Something like that. No? So you can easily, if you understand, that's why I said you have to listen 1 week, the same audio, but practice other listening practices, materials, audios.
One doubt regarding to find out the synonyms. For example, that today father told like before the trial, we can here it's easy that pre-existence condition. So when I'm trying with another task, if I couldn't find out like this synonym, so how can we find out that synonym?
No, that's why one thing I'm telling you, if it is an official material, that's why I'm telling you, normally I don't select any paragraph, any material for any of my sessions. I ask people now, this time I asked Rajani and Soumya to send me some material, especially which I have done maybe A part and B part. If I have done my session and video is there, send me the C part of it, listening. So I have done the B part of this particular material. So Soumya send me C part of it, text 2. And I simply picked, but when I picked, I saw some inconsistency. So I rejected it. Then again I picked it because I knew the language functions are there, but then answer options are not placed properly. Okay, looking at the key, we can make out easily whether the material is official or competent, just looking at the key. If you have followed my elimination method, I told you how should be the answers. If the answers are 3 options and more than 50% you have 1 option, that material is not official, not competent, not benchmarked, or not customized as per the competitive exams. But what Jaladam is telling, now the issue is this, some of you send me some passage and ask me why this is the answer. I cannot tell you because that is not the correct material. You will have to ask the author of that material. So that is the issue. If it is a correct material, Jalajam, you will definitely have these things. I told you in all the reading and listening, I showed you this clearly, this sequence.
Yeah.
Now don't worry about the repetition. Take down these points and listen to it again. While listening, try to identify these sequences. Multiple skills are tested in listening test, only in listening. You have to listen, you have to read, you have to write. As you listen, you have to read the answer options, right? Question and answer options. Then at the same time, you have to mark the answer. So writing, reading, listening simultaneously has to go. That is the real competency. That's why I said the 3rd step I said, take the 4th step I said, listen to the audio, read the script in your mind and underline and scribble all the highlights. And by the end of your practice of your listening test, the script should be so much scribbled. If you show to someone else, they will say maybe children have scribbled on your text. It should be so what you call nasty. It should look okay. Don't keep it very safe. And if you have time. Pardon?
Do you have time to continue?
Yes. Why? I can spare a few more minutes, no problem.
Okay. Father, how we can utilize that 90 seconds with all these options and the questions?
Yeah, the thing is like you don't require even 90 seconds. If once you practice well, as you go through the questions, I said, no, when there is why, it is a reason, you know. Okay? Why? It is a reason. So always you have to look into a reason. When they speak about a reason, they will definitely speak in the context. They will say this is this because of this.
Okay.
Okay. And when they are asking for cause, because of something, that is a cause and effect. Because of this, that happened. So you have to just circle or underline whatever you want to do, highlight or flag the key stem words in the question. You don't need not underline everything, only the key options. Okay, first you just go through that. Answer options you can just glance through if you want. Otherwise, you can do it while listening to the audio. But then question stem, you should be very thorough. For example, the comparison and question difference, they asked what is the significant difference between sprint and accord, two studies. So you have to look at the main difference. Or else when they are asking for a reservation, you should see what is the objection being raised. Yeah, that's how, it doesn't happen in the beginning. I tell you, even those who have written 10 times, it will not happen because they have not practiced in that way. In the initial stage, what will you do? You can't even move. You will suddenly brake. You will suddenly put accelerator and everything happens. So it takes patience. Step by step. If you have not understood, don't go forward. Ask somebody, get it clarified, then go forward. Is that clear?
Yes.
So you will not be able to do within 90 minutes in the initial stage. Initial stage means, it doesn't mean whether you have been practicing for 6 months, still you are in the initial stage if you are not able to do with 90 minutes. Okay? So beginner means beginner with the strategies. So you can decide whether you are a beginner or not. Now in the initial stage, instead of might require 5 minutes. It's cool. Take 5 minutes. Understand. Or 10 minutes you take instead of 90 seconds. No problem. Gradually the time will be reduced. And then later you will understand, within 60 minutes you finish, 70 minutes you finish 7 questions. Now 20 minutes left. Let me go again somewhere and read. That will happen. Definitely it will happen. Because I tell you, all these questions are of the same taste, same color, same texture, and everything is same. If you practice strategically, it smells the same. As soon as you see a question, you understand comparison and contrast. Oh, there is a trick like this. Unlike this, that, they will put, okay, they can't trick me. So you should learn the trick and trick them immediately. That happens by practice. Patient, consistent practice. That's why I said you will not be able to complete one C part listening text audio 2 within a day, even if you sit full day. In the initial stage, just for listening, part C, listening, text audio 2, just to do these 7 questions, your 12 hours will not be sufficient in the initial stages. But if you do it accordingly, it's equal to of your practicing 50 listening materials. Because I have seen people who have exhausted all the possible materials. And there are people who have purchased all the materials. This was a bit advanced, my session, but giving the minutes. Beginners may find it. Yeah.
It was very interesting, Father.
Beginners may find it a bit difficult because challenging, because they may not know what is scale, what is opinion, what is modal verb. So maybe in your own way you can explain. I will also teach you later. You can make a pseudo group either in Telegram or WhatsApp. Pseudo group means if you have 2-3 numbers, add your own numbers or add some other people from your home, their numbers, then you can remove them. Am I audible?
Yes, Father. Yes, Father.
So that will remain a group. For example, you can say platform assistance group or my notice group or my interaction group. You can put a name and only you will be there. You can forward all the notices required. You can save it there. Every day when you come to the platform, if you need to repeat that notice, you can just copy and paste here or forward it here. Got it? So nothing to do. Maybe 1 or 2 days you have to do something. Later you will understand. if somebody sends some information about some aspect of the platform, you can save it in your folder, pseudo folder. Then next day you can post it. See, people don't know what's happening. For example, the daily task, the reading challenge, listening challenge, what they are supposed to do. Okay, and what else is there? Poll, then a discussion, group discussion, Zoom sessions. Okay, applications, all those things. Yes.
Yes, Father.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with a neurosurgeon called Dr. Ian Marsh, who specialises in the treatment of concussion in sport. You now have 90 seconds to read questions 31 to 36.
My guest today is Dr. Ian Marsh, a specialist in the treatment of concussion in sport and a co-author on a new set of guidelines. So, Dr. Marsh, what's the aim of these new guidelines?
Well, the aim was really to provide a resource, not for the top-level professional sports people, but for parents, teachers and coaches of young people playing sport.
Mm-hmm.
The guidelines basically offer some expert information from a GP, an emergency physician, and myself as a neurosurgeon about what the condition is, also how to identify the symptoms and how to manage it. If any of your listeners have ever had a concussion doing sports, you'll know how frightening it can be. It's confusing and painful and difficult sometimes for teachers, parents or whoever to work out if someone with concussion is okay. I mean, we hope to remedy that.
Mm-hmm. And how do we know when someone is suffering from concussion?
Well, obviously if the person's actually knocked out, it's clear.
Mm-hmm.
But not all patients actually lose consciousness. Often, following a hard knock to the head, they become disorientated or experience headaches, nausea or vomiting. These are signs of concussion, and they may clear initially, but then return when the individual actually undertakes further physical activity.
Right.
When they start to train, say. So it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing again until those warning signs have completely subsided.
Yes, and you say that waiting anything less than 14 days after all the symptoms have cleared would be too early to return.
Yeah, that's right. If they go back too early, they risk a second concussion, and as we know from professional athletes, they may have to give up their sport if they have too many concussions.
Right.
So it's better, particularly in a young person with a developing brain, to allow all of the symptoms to settle and only then return to play. Well, usually return to train first, then return to play after that. It used to be thought that receiving another concussion could lead to severe brain swelling, and that could be fatal, or at least involve a visit to the emergency room. I think the evidence is fairly slim for that. What we do know, though, is that the compounding effect of having one concussion followed by another seems to be more severe than just the one. So it's always better to let the brain recover fully before playing again.
Right, so who's at the highest risk of sports concussion?
Well, actually, a concussion can happen whenever anyone receives a blow to the head. Usually it's a sort of twisting blow, not a straight-on blow. But obviously, people playing sports like rugby, where there's bodily contact, stand more chance of being at the receiving end of such a blow. But having said that, it's just as likely to affect kids kicking a ball around a park as it is to affect top professional players in big matches.
Do you think that youth sports need specialist concussion doctors on hand, like the professionals do?
There's always a risk, and we know that it happens from time to time. But I mean, most games, even the most dangerous ones, are without incident at all. I think people who are involved in running youth sports, whether they be referees, coaches or parents, can be made aware of how to manage concussion, the signs that they need to look out for, and maybe the warnings of something more serious so that they can take the appropriate actions. But I think always having a doctor on the sidelines where young people are playing is just an overreaction.
Right. In the USA, college football is big business. They're trialling helmet sensors and impact sensors. Do you think that's something we need everywhere?
Well, I don't think it'll come to that. I think there are two scenarios here. The first is one where a concussion's a one-off event following a significant blow to the head.
Right.
The second's quite different and involves chronic traumatic encephalopathy. This comes about particularly in American football, where players use their helmets and heads almost like weapons. That type of repeated impact seems to add up over the player's career. That's something we've heard being discussed, mostly in the USA. Naturally, there's interest generally in protecting players, particularly in the professional levels of sport, but I see that as a different matter to the management of concussion itself.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a presentation by a consultant cardiologist called Dr. Pamela Skelton, who's talking about a research trial called SPRINT, which investigated the effects of setting lower blood pressure targets. You now have 90 seconds to read questions 37 to 42.
Hello, I'm Dr. Pamela Skelton, consultant cardiologist at this hospital, and I'm talking about the recent SPRINT study into the effects of setting lower blood pressure targets, which in turn affects the advice and medication which patients are given. I'm going to describe the patients who were selected, how the trial was conducted, and the implications of its results for us all as health professionals. First, the trial itself. It involved over 9,000 hypertensive participants, aged 50 plus, most of whom were on blood pressure medication. They were randomly assigned to one of two groups, one with a goal of less than 120 millimeters systolic BP, the other with a goal of less than 140 millimeters, the traditional standard. The intention was to follow these patients for 5 years, factoring in the usual dropout rate. As it turned out, however, the trial was stopped after just 3 years, thanks to an all-cause mortality reduction of nearly 30% for the 120 group, which was definitive and shocking, but wonderful. As I mentioned, the participants were over 50s, and it goes without saying that as people age, they develop more diseases and health problems as a matter of course. But there was a specific group of over 75s who did just as well as younger patients. Before the trial, some medics referred to the natural stiffening of the arteries with ageing, suggesting that 120 was too low a target for the over 75s, risking an increase of dizzy spells, which would affect general well-being. But this concern turned out to be unfounded. Others thought there would be a failure to take the number of tablets needed to reach a BP of 120, especially among older participants. Again, this wasn't an issue. The average needed was just 3 per day. The over 75s, already on various drugs, didn't object to extra medication. Participants from this age group who didn't finish the trial were taken out because some conditions, which were already present, worsened. For example, in some cases, obesity levels rose too high. To manage their blood pressure, participants were given standard drugs, nothing experimental, just drugs that are readily available and low cost. Another key factor was that blood pressure was measured in a very specific way. Rather than give patients an arm cuff for at-home 24-hour ambulatory monitoring, an automated machine was used at the hospital. This took 3 separate readings and averaged them. Also, readings were taken while staff were out of the room to avoid what's called white coat syndrome in patients. Now, some of you may be familiar with the ACCORD study into blood pressure levels several years ago, which in some respects was similar to SPRINT. There are some differences, though. For example, ACCORD was about half the size of SPRINT, and unlike SPRINT, the ACCORD study allowed diabetic patients to take part. Despite this, in general, the ACCORD participants were rather lower risk than those in the SPRINT trial, probably because of the slightly lower average age. The ACCORD trial didn't show a statistically significant benefit for overall cardiovascular outcomes, but there was a clear 40% reduction in strokes, even though that was a secondary outcome. So, to summarise, the SPRINT trial seems to support 120 as a recommended blood pressure target. This is doubtless a landmark study, and importantly, one which was sponsored by government rather than by the interests of pharmaceutical corporations. I recommend a note of caution, though, as SPRINT does contradict previous findings. The Cochrane view, in 2011 for example, said that lowering to under 140 didn't produce a change in the risk of death overall. However, we must bear in mind that Cochrane was looking retrospectively at trials which weren't actually focused on the same particular issue. So it's worth doing a full and systematic evaluation to see where the sprint trial fits in with what we already know. It's interesting that a few GPs have already been working with older patients to hit lower blood pressure goals, and the new data will doubtless encourage greater take-up of this more interventionist line of attack. But the sprint results don't mean that everyone with hypertension should be dropping to under 120. Plus, to achieve those lower levels, it's unlikely that lifestyle changes alone would be enough. It could well require several antihypertensive drugs as well. There remain some unanswered questions, of course. For example, whether other groups, like those with a lower heart attack risk, need to keep their blood pressure that low. So, while Sprint can help guide doctors' decisions about some patients, it doesn't mean that a new universal standard for blood pressure is in order. Instead, it's a good reason for everyone to discuss with their doctor their own ideal and particular target.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.